Hi, this is Jamie Fuchenberger. I'm the clinician today, and this is Lisa, the client. She is 59 years old, and today we will be doing an adult pre-interview form as well as a speech screening. So how are you today, Lisa?
I'm good. How are you?
I'm good. How is your husband? Is he working today?
Mm-hmm.
Okay. We're going to start with the adult pre-interview form, and then we'll go on to the speech screening.
Okay.
Okay. So I have a few questions to ask you. Describe your present speech and or hearing problem. And what do you feel caused your speech problem?
Memory, figuring things out, I have problems with, and it's all due to my MS.
Okay. When did you first notice this problem? When did it first occur?
A while back, I kept falling unexpectedly, and that's when I was diagnosed with MS.
Okay.
But then my speech problems have just begun that are like the memory and the figuring things out problems.
Okay. Describe any changes in the problem since you first noticed it or since you first were diagnosed.
Falling more, memory problems.
Have you received any help with this problem, either speech therapy or any other way?
We have a caregiver at home that assists me when my husband's at work.
Okay. What medications do you take?
I know I take some, but I can't remember. My caregiver or my husband, they would know what it's called, but they are the ones that normally give the medications to me.
Have you had any serious illnesses?
No, not besides MS.
Okay. What else should we know about your speech problem or any other problem that you may have?
I also have blurred vision, especially when I read things. It's really hard to read.
Okay. Okay, and that is the end of the adult pre-interview form. So next we will move on to the speech screening. Okay. All right. Could you stick out your tongue for me? Could you move your tongue from side to side? Can you pucker your lips? Say ah for me. Smile for me. Say pa, 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 pa. Now ta, 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 ta. And how about k, 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 k. Now we'll do it all together. So pa, ta, ka, pa, ta, ka. Okay. I'm going to administer some pureed liquids for you to try, and I'm going to observe. Okay. Next, I'm going to give you water to try. And then last, the cracker. Take your time. Okay. I'm going to ask you a few questions. Okay. What is today's date?
November 28th.
And what is the day of the week?
Wednesday.
What month are we in?
November.
What year is it?
2018.
What season of the year is it?
It's winter.
And where are we? What place or facility?
I can't remember the name.
Okay.
but it's a hospital.
Okay. What room are we in?
I'm not exactly sure.
How about the city?
California,
Okay, how about the state?
Pennsylvania,
And what country are we in?
United States.
Okay. Now I want you to tell me what kind of work you've done in the past.
I used to work at a bank as a data processor.
Okay. Now I'm going to say 3 words slowly, and I want you to repeat them when I'm done.
Okay.
Ball, flag, tree.
Ball, flag, tree.
Okay. Now I want you to start with 100 and count backwards by 7s.
Okay. 93, 86, 74, 62, 58.
Okay. Spell world backwards for me.
D L O R W.
What were those 3 words from earlier that I asked you to remember?
I can't remember.
Okay. I'm going to hold up objects and I want you to name them for me, okay?
Okay.
What is this?
Pen,
What is this?
hand,
What is this?
a pillow,
What is that over there?
a door,
Okay. What is this?
the ceiling.
Okay. Now count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Tell me the days of the week.
Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday.
Now, finish these sentences for me.
Okay.
3 strikes and you're
Out.
I pledge allegiance to the
Flag.
the phone is off the
I'm not sure.
Okay. As you leave, close the
Door.
For fresh air, you raise the
I can't remember.
That's okay, we'll move on. Repeat these words after me.
Okay.
Buck,
Buck.
home,
Home.
spice,
Spice.
scarecrow,
Scarecrow.
tornado,
Tornado.
administration,
Administration.
under the old wooden bridge.
Under the old wooden bridge.
The silver moon hung in the dark sky.
The silver moon hung in the dark sky.
Okay, we're moving on to some yes or no questions. Just answer me yes or no. Is your name Johnson?
No.
Is your name Lisa?
Yes.
Do you live in Rhode Island?
No.
Am I touching my eye?
No.
Do you wear a glove on your foot?
No.
Is a chicken bigger than a spider?
No.
Do you put on your shoe before your sock?
Yes.
All right, lastly, I'm going to give you some directions and I want you to follow them.
Okay.
Point to your nose. Open your mouth. With your left hand, point to your right eye. Point to the floor and then point to your nose. Before opening your mouth, touch your ear. Okay, and that concludes the speech screening. So, Lisa suffers from MS, which causes deficits in her reasoning, problem solving, and short-term memory. She shows receptive difficulties. She is being referred to speech therapy and PT for falls. She is also being referred to an optometrist for her vision deficits. So she had trouble with the attention task, spelling world backwards, delayed verbal recall, orientation and sentence completion, as well as yes-no questions and following directions.